I think the problem started just after, so it should be fine.
Okay, so the arginine is involved in the nitric oxide production, and not only. The main function of arginine is that being a basic amino acid, it is a modulator, a natural modulator of the power of TCA. TCA is an highly aggressive molecule, so if you use the TCA in the concentration we put inside, you create frosting that turns then in browning, and people have to stay home for a few days, maybe weeks. But thanks to the arginine, we managed to modulate the power of the treatment and to use such high concentration of acid in a completely safe way. The last active principle of the revitalizing complex is riboflavin, which gives the formulation the typical yellow color. It is a natural vitamin, vitamin B2, and we put inside this molecule because of the great antioxidant effect. So it is one of the most powerful natural antioxidant, and we think it's very useful to contrast the active oxidant species bad action. Last, we find the peeling complex, which is, of course, in the sector of market of peeling. It's, how can I say, the main actor of our formulation. So we start from trichloroacetic acid. The application of trichloroacetic acid on the skin induces the activation of an inflammatory response. So you apply the product, you apply the acid, you create the damage to the skin, and the skin reacts with the proliferation, with the stimulation of fibroblasts, cellular proliferation. And the activation of this response is the skin stress response system. So it's a system that everybody has on the skin, and it is an indirect biostimulating activity performed by the product. The second acid we found is lactobionic acid. The lactobionic acid is important because it is a powerful moisturizing molecule. You can see how many alcoholic portion it has on the molecule, so it has the ability to retain water. Moreover, the lactobionic acid is the substrate for fibroblast and keratinocyte to produce collagen and cosaminoglycans. We find the salicylic acid. The beta-hydroxy acid is a powerful keratolytic molecule, and it has also a bacteriostatic activity. So the salicylic acid is very well known in aesthetic medicine, and it's particularly important to perform successful treatment on acne. We managed to have very good result on acne thanks to the salicylic acid. Not only, but it's very important for this. And finally, we find the tartaric and citric acid. They are alpha hydroxy acids, and they improve the action of TCA because this acid, being polyhydroxy acid, has the ability to bind the calcium ions. Calcium ions are bivalent ions that stick together the gathering of the cells. And if you remove these calcium ions from the skin, you manage to break the skin and to have the keratolytic effect. So it's another mechanism of action respect to the TCA, and it improves the action of TCA on the skin. So here we have a summary of the 9 main actions of our formulation. I remember the hydrophilic yellow phase with the biostimulating, revitalizing, empiric, and keratolytic action. They have anti-wrinkle and antioxidant action, and anti-acne and comedons action. The lipophilic blue phase has a protective and stabilizing activity, veiculating activity thanks to the active principle contained inside, and regenerating and moisturizing activity on the skin, which is very important to how can I say, to improve the feeling of the treatment. So what is very important to understand for me is that differently from other products on the market, the BIOREPEELCl3 is not a simple peeling. So we don't have just the biostimulating effect indirectly, but we perform both the indirect biostimulating activity and the direct biostimulating activity by providing the skin all the active principle that we described, especially at the beginning with the amino acids. So now I want to leave the words to Agnes, because she will explain all the protocol of use, all the protocol that you can use with BIOREPEEL, and Carlo Gagliardini as well. I hope he will help us with some combination, especially with the machine. So please, Agnes, you can move on.
Yeah, hi. Regarding the protocols, the protocols will always have to be adapted. If you like, just send the email address. I'm going to send you written protocols, but as I said, you need to adapt them. The product is suitable for all the skin types, all the skin conditions. When you paid close attention, you've got arginine, so you're going to have a really good rosacea treatment. The skin with broken capillaries, do not be afraid to use TCA on those skins. TCA will not be aggressive. It's buffered with arginine, so it's very safe to use and brings really good effects. All the treatment of the scars or stretch marks, when you look at the scars under thermoactive camera, they're going to be blue or greenish color because there's not enough capillaries, there's not enough vessels. The tissue is half alive, as I said. So by damaging the tissue and applying BIOREPEELCl3 on it, you are really inducing the growth of the capillaries, the growth of the vessels. So it's going to have really good effect. So as I said, all skin types, all skin conditions, you can use it all year round. It's not photosensitizing product. You can also use it in combination with different machines. And doctor is going to talk about it in a minute. Regarding the acne, which we have quite a lot of questions on, of course you can use it on active acne, but you do not combine it with microneedling. You do not combine it with microneedling because it would just cause the spread of bacteria and it would have completely adverse effect to what you were intending to do. I'm thinking about different skin conditions. Of course, aging skin. Of course, sun-damaged skin. Someone was asking about the protocol on melasma or different types of pigmentation. Of course, it depending on the pigmentation you want to treat. If it comes to melasma, I'm combining TCA 35% and 50%. It could be you could use 50% body just on the spot if you're a doctor. You can combine TCA 35% and 50%. So you can take 1 milliliter of 35, 1 milliliter of 50, and you get roughly 42% of the product, which is going to cause a little bit more peeling, but also will allow you to get rid of the pigmentation much faster than you would do just with face, neck, and décolleté product. Regarding the protocol with microneedling, you take 2 milliliters. I don't know whether we have the written protocol here. I don't think we have it on the slides. I'm just going to double check. No, we don't have it on the slides, but I will send all the written protocol so you can go through it in your own time. The microneedling protocol you do every 10 days. At least I do it every 10 days. With older skins, you can stretch this period to 14 days. But remember, when you work with microneedling, you do not work very deep on the skin. You work between 0.25 and 0.50 millimeters. It's absolutely enough. And the protocol would be almost the same as if you would just use the product itself. Sorry, I'm just going to check the question, Doctor. You started to use mixed protocols face neck. Yes, in one syringe. Yes, if it comes to melasma, if it comes to pigmentation, I would use the face neck and body in one syringe. I would take 1 milliliter of two products, so 1 milliliter of face neck and décolleté and 1 milliliter of body. Mix it in one syringe, and that it would give me around 42% of the product if it comes to the percentage. And it's going to be very effective on the sunspots. It's going to be very effective on different types of pigmentation. So that's correct. You can mix those two products together. Regarding microneedling, you would do exactly the same as you would use the product. So you would just cleanse the skin. You would degrease the skin. You can use acetone. You can use alcohol wipe. Then you apply 1 milliliter of the product on the face. You massage it onto the face. After you do microneedling, I just do the stamping. I don't drag any machines on the skin because it has been proven to cause quite a lot of fibrosis in the skin, especially in the deep tissue, if you would be working quite deeply. And once I microneedled, I'm going to apply a second milliliter of the product onto the skin. Massage it onto the skin, and once it's absorbed by the skin, I'm going to leave it for 5 minutes and then remove it with water. You do not need to neutralize the product, you just need to remove it with water, and that's absolutely fine. And of course, post-procedure, depending on the skin type, you're going to use either BIOREPEEL or BIORELIFT. BIORELIFT is going to be more appropriate for those greasy skins, for the skins for the really hot climates. BIORELIFT is for those skins needing more hydration, more moisture, for the tired skins, for the sun-damaged skins. I don't know, maybe you would like to say, Carlo, something to do with machines, the protocols, how can we combine it with LED lights?
Yeah, sorry, a little bit of cough. So yes, now I would like just to say something about integrated protocols with technologies, because it's a question that people ask very, very often, and I would like to say that there is not some precise protocols, because every professional can find the most suitable for his own or her own patients. But I would like to just make some indications, because let's say which are the most common used technologies, and I think those will be radio frequency, HIFU like ultrasounds, and pulsating lights and lasers. In this case, I would just like to remember that some principles inside the BIOREPEEL are anyway a little bit, does have a little bit of photosensitivity. So it would be interesting not to use BIOREPEEL and immediately after lasers, because one of the principal problems in aesthetic medicine is the passing, the destroying, the block that the corneum layer provides. So for the active principles inside the BIOREPEEL, is going to be useful to have a little bit of weakening of the corneum layer. In this case, for example, speaking about lasers, I would like to tell, first, use the laser. Then you can use the BIOREPEEL also in the same session. Obviously, consider that you're going to have quite an irritated skin after the procedure. So use a weak protocol of BIOREPEEL, because it's going to sting very much. So in this case, don't use, at least try not to use too much aggressive lasers. For example, I would prefer not to use fractional lasers, but for example, using pulsating light for rejuvenation, or erbium lasers, but not surgical lasers like CO2 or fractional. And everything goes as well for the pulsating lights. So before the light, then the BIOREPEEL, also in the same session. consider that it's a little bit aggressive, but it gives good results. For radiofrequency, you can use it together, but I would tell not to use it on the same day, because the radiofrequency heats up the skin. The heat of the skin goes up, and it can get too sensitive to the acids of BIOREPEEL. And for IFU ultrasounds, for example, those are going to be very useful together with BIOREPEEL, but I would see that as something that you use or in between the sessions. Again, not in the same session, the skin can be sensitive to ultrasounds. Or I would suggest a complete session of 4-5 sessions of BIOREPEEL, a complete protocol of 4 or 5 sessions of BIOREPEEL on the face, for example, after 2-3 sessions of IFU ultrasounds. In this way, you can get the tightening of the skin much quicker. This is for the basics machines. Obviously, you can have other interactions, but just let me know if there is someone that would like to know of some particular technology.
Brilliant, thank you very much. I was just thinking about one more protocol which is quite popular, and it's combination with mesotherapy. So, you know, as you know, BIOREPEEL, it's one of those one of the peel which you can use after you applied MLA cream, after you applied priming cream to the skin. It's not contraindication to use it at all. Regarding the protocol, it depends really, you know, what would you like to achieve, whether you would like to achieve stronger peel, whether they would like to achieve stronger action. Well, I do it once I numb the skin, I leave the numbing for 20 minutes, depending, of course, on the strength. Then I'm going to do needle mesotherapy, and after needle mesotherapy, straight away I'm going to do BIOREPEEL. Just massage 2 milliliters into the skin. I'm going to use only face, neck, and décolleté in this case because the skin barrier is already broken. And then I'm going to massage into the skin and leave it for 5 minutes. And the results are really amazing. You can see the results straight away after 7 days, usually after one session. Of course, you need 4 to 5 sessions, depending on the skin type, depending on the treatment you're performing. It's mostly going to be for sun-damaged skin, for those dehydrated skins. But I do recommend combining it with mesotherapy or microneedling for the faster results, for really quick results. And I said, and there's not much downtime. You know, there could be another question, which am I going to peel? And my answer is, I really don't know. If it's the customer or the client who comes to me for the first time, I always ask them to bring everything they have, all the skincare they have, because it's really, really important to check the skincare they're using at home. The only time when you can have problems, when you can have any reactions after BIOREPEEL CL3, it's when the customer or the patient is going to be using wrong skincare at home. It could be something they won't know what they're using very often. It could be something with retinoids. It could be something with AHAs or BHAs. So ask them to bring all the skincare with them. And how I do it, you know, for the first visit, when I do the consultation form, they're actually signing that they're going to be using the products during the treatment time, which I'm going to recommend, which is always going to be BioRelief or BioRehydra. And then I can guarantee you won't have any problems, you won't have any complications. Remember, it's really, even though, you know, it doesn't give you frosting, it's a really strong product. It brings strong revitalization to the skin. So putting another product onto the skin which have active ingredients can cause more irritation to the skin. If the irritation happens, what to do? Nothing. Just let the skin recover. You know, switch them straight away to BioRelief or BioRehydra, and the skin is going to recover. And you continue, depending on how the skin is healing, 7 to 10 days, another treatment. Do not be afraid. Even if there's a little bit of irritation, you can still continue the treatment, but you need to remember to change the skincare regime at home. If you have any questions or any protocols you would like to ask about, just type in on. Later on, we're going to try to switch on the microphones so you can ask all the questions. I'm just checking. Another thing, BIOREPEELCl3, face, neck, and décolleté, you can use on the eye area. You can also use it for intimate area revitalization, and the protocol is exactly the same as if you were applying it on the body, on the face. So you do the treatment every 7 days for 5 sessions, then 3 months. You can have a break, and after 3 months you can repeat the protocol again. But you only on the intimate areas, you only use face, neck, and décolleté. Otherwise, it could be too strong. I'm just checking. Now, very important technical part. I don't know if I have the pill with me. I do. Sorry, I'm just going to grab it. When you're going to be using it for the first time, because of the high concentration of the peel of the chemical agents, the pressure is going to build up. So what I do, once I remove this tiny lid from the inside, first of all, I just take a syringe and release all the pressure. It's really important to mix the product really well, because you need to mix 2 phases. If you want to do it properly, the first phase which you're going to take with the syringe is going to be lipolytic phase. It is going to leave you just with hydrophilic phase, and you're not going to have this full effect which we could achieve with the product. So mix it pretty well until you have really smooth one color substance. And please just make sure, as you're mixing, I still have little tiny particles of the lipolytic phase. So you really need to give it a time. Once you mix it, once you have shaken it well, then you take 2 milliliters. It says 1.5 to 2 milliliters per phase. I always take 2 milliliters. I never take 1.5 milliliters. I find it's most effective. And then you apply it onto the face. As I said, you don't need to remove it. You don't need to neutralize it. You just remove it with water. So no needles, no frost, with one exception. When you're using it on active acne, when you have the skin which is already compromised, you might have a little bit pinpoint frosting, which is nothing to worry about. You just leave it on the skin. You don't need to remove it. You're going to have a little bit more peeling on the spots, but it's not side effect. So please don't worry about that. Another time when you can have a little bit of frosting, when you're dealing with papules, of course you're not going to be removing them physically, but what I do when I have papules, quite deep papules, first I dry needle it. So I'm going to use sterile needle. I'm going to prick all the papule in 2 or 3 places, and then I'm going to apply the product onto the papule, which is going to help cleanse the skin, help to disinfect the skin and get rid of all the substance which is inside the papule. So you can do it this way, and in this case you can have a little bit of frosting. As Carla said, it's multifunctional. It doesn't cause scarring in Fitzpatrick 4, 5 or 6, which is really important, because there are some products, as we know, with Fitzpatrick types, we need to be really careful how we treat those. We need to be treating them, more delicate than Fitzpatrick 1 or 2, because they're going to be responding much faster in hyperpigmentation or scarring. BIOREPEEL will not be causing scarring in the skin. I have tried it on Fitzpatrick 6 multiple of times. It never caused any problems at all. It's very safe for all Fitzpatrick types. Apart from that, you don't need to keep it in the fridge. From 5 to 25 degrees, it's absolutely safe to be kept on the shelf. Once you open the bottle, recommended time is 1 month. But it's absolutely enough time, to use it either on one patient or the different patients which are going to be coming to your clinic. For all ages, depending on your country regulations, but probably in most of the countries under 18, you're going to need parental permission, written parental permission to use the product. No ammonia in the product and no photosensitizing. Of course, after each treatment, you need to use SPF. Recommend using SPF every day. And at least in London, I get many questions: when can I go to, sunbed, or when can I start tanning? And my answer is no. Simply never. It's not good for your skin. Just don't do it. But if you are to do it, please use SPF. As a doctor already explained regarding photostimulation radiofrequency, the protocols of use, so I'm not going to be repeating it. And that's it. What I would like to show you as well, just let me quickly take the presentation. I would like you to present you with the clinical evidence prepared in collaboration with Professor Maurizio Cavallini. And 2 words about Professor Dr. Maurizio Cavallini. This presentation was made with help of Antera 3D method. It's a skin analysis. It allows to see the skin in 2 and 3 dimensions. Professor Cavallini is a senior aesthetics key opinion leader. He's also a key opinion leader for many big companies in Italy, and we are really proud of collaboration with CIMED Aesthetics. He has specialized in microsurgery and experimental surgery in University of Milan. Also, at the moment now, he's also mastering aesthetic surgery. Completed University of Milan in 2007. He's also professor of level 2 master surgery in aesthetic medicine from 2018. So we really appreciate his cooperation. And he performed the test using Anthera 3D. It's an innovative skin analysis device, which I said allows for the 2 and 3 dimensional multispectrum analysis of the epidermis and dermis. The devices, as I said, use optical acquisition method. It allows for very careful and deep penetration of the texture of the skin and can show clear images in 3D. It measures the skin, the texture of the skin, the depth of wrinkles, and shows clear improvement in the values of the skin, whether it's a rigor or density of the skin. The first protocol, which was performed, it was a protocol performed with face, neck, and décolleté. The application area was on the face. We used 2 milliliters of the product. There was 4 applications in intervals of 7 days. The protocol was of a female patient, age 30 years old. The tomography detail was the right cheek. As you can see clearly here, it's 2D demography, which shows the improvement in the skin after 2 sessions. But, you know, we all use picture evidence, but picture evidence or the naked eye will not always be able to show the real improvement in the skin. Therefore, Anthera 3D can show you really clear improvement on the skin. So you can have clear vision of the 3D demography on the same area. And that's before and after pictures. And you have comparison here. So there's 2D and 3D protocol. So you can see clear improvement in the rugousy of the skin. And comparison demography analysis. So there's a clear improvement in 24% in rugosity of the skin before and after the treatment. The second protocol, which was performed, it was the neck area. Application volume was 1.2 milliliters, 5 sessions, interval every 7 days. Age of the patient was 42 years old. It was 42 years old, female, and the performance on the neck. You can see clear 2 demography pictures of the before and after. Even with the naked eye, you can see clear improvement onto the skin. But I would like to show you the results using 3D demography. And there's a clear improvement in rugosity of the skin. And the comparison 2 and 3D results after 5 treatments. Improvement 25.5% in rugosity of the skin. It was the area of 1 millimeter. So you have really clear, very detailed results. Those results were presented in Agora International Congress, which happened in 10 to 12 October 2019. Dr. Cavallini presented those results, and they can give you really clear indication of how the product is working, of its intensity of working, and the wonderful results which you can achieve with it. So thank you very much, and I'll pass to Andrea now.
Yes, thank you. Good morning to everyone. If it's possible, Agnes and Carlo, I kindly ask to reply to the few questions about.
Yes, certainly, I'm going to do it now.
About how often use the product, can use in breastfeeding, pregnant scar protocol, and I don't know.
Okay. Shall I do it now, or can I do it after you finished your presentation?
We can do after. The important.
I'm just going to write down all the questions, and then I'm going to answer them after the presentation.
Okay.
Yep.
Yeah, great. Now we will see our work experience is not long experience, but it's very intense. It's take the last 2 years and a half. And can you flash the light? Our market start in the January of 2018 from Italy, and from Italy we start to selling the product in the clinics with sub-distributor. And during this 2018, we start to spread the product all worldwide. And now, in January 2020, the situation after 2 years is a little bit changing, because we have covered a lot of part of the world, and we have many open process of registration in another part of the world. As you can see, the green nation are the nation that we are just distributing, and in the yellow nation we are in the registering process. Now we show you some of our experience worldwide. There is speak from Seoul, Montenegro. In Montenegro there is Kallio Gagliardini, like leader. We have Latvia in Riga. We have Bulgaria, we have Moldavia, we have St. Petersburg, Russia, of course Slovakia, Azerbaijan. A lot of trip and a lot of experience where we have met a lot of very good doctor and person. And during these 2 years we have covered 5 continents, more or less 51 nations, now are three more. And last year we have performed around 750,000 treatments. In this year, we forecast to have around 1.5 million, but we will see with this big problem of coronavirus. But we are very positive that we will solve very soon. And of course, we are take from the market many experience of our doctors and our user. So we can see from the words of the doctor what BIOREPEEL can do. The first is the prevention of skin photoaging, of course, also in the young skin. The skin photoaging can solve. Can you slash please? Also in older skin, but we have the same good results. Another interesting action is, of course, the prevention of the fine wrinkles, and also in the deep wrinkles in the old woman. In the photo, we can see also a good improving on the spots on the cheek. Wrinkle treatment is very good and very effective also in the neck and also in the décolleté. All the results come from our doctor worldwide. As you can see, we are taking the photo from Instagram. Another active of the product is in the texture of the skins, also in the young skin, as you can see in this photo. The lady is very young and they have very good skin, but after the treatment, they improve a little bit, very beautiful skin. Another interesting action is the skin color improvement, because sometimes the skin of the face is a little bit old, and so he needs a refresh to come back at the best situation. Of course, as Alice told, the acne is a very good focus on the product, but with the right protocol, because if you don't do the right protocol, you can spread the acne and it's not so good. But you can achieve very good results in the acne, and also, as you can see in the next photo, in the post-acne scar. This is a young one. Now we will see what our client's doctor do in association. The first association comes from Russia, is the association with the ultrasonic spatula. Then we have the association with light therapy. Agnes, can you say please the wave of the light for the radiofrequency?
Certainly, for the LED therapy, if you're dealing with acne, the best wave, the best wavelength is between 430 and 460 nanometers. If you're trying to improve the rugosity of the skin, if you're trying to improve the density or revitalization of the skin, so the best waves are going to be between 630, but also near infrared wave, which is 830.
Okay, thank you so much, Agnes. Yeah, we can continue. Now we will see the association with microneedling. In some part of the Russia, they call this protocol BIOREPEEL. Is a video. If we can push. Okay. The video is very quickly. Of course, the BIOREPEELs can use on the body. In the association, for example, for the stretch mark, is very interesting association. Or in association with PRP. Protocol is very common with the PRP. In the first session, we do both. We do BIOREPEEL and PRP, of course. And if you use a classical protocol of PRP, and that means 1 time a month for 3 times. During the first months, you can do the first time BIOREPEEL and PRP. During the months, you do PRP, and after the recall, 2 months without BIOREPEEL. After 2 months, you can restart the synergy of PRP and BIOREPEEL. This is all the result from your colleague of worldwide, and we think that BIOREPEELCl3 is a winning choice for you and for your patients. Now we will see what BIOREPEEL can do, and here there is the required treatment for repealing. As you can see, we have shown to you that all the points are doing for BIOREPEEL, like prevention of skin aging, fine wrinkles, wrinkle treatment, hyperpigmentation, skin texture and color, acne, post-acne, and large pores. And another important thing is what the patient's needs now. You know better than me that the patients want immediate effect. We want visible result and in a short time a longer term result. We want pay-free treatment. We want treatment, no seen after the treatment, and the important thing is return immediately to the social life. What there is on the market. The classical peeling on the market can be of one acid, of TCA, of course, a mix of acid, a mix of alpha, beta, and polyhydroxy acid, but all this peeling work in one mode. They work with the classical mechanism of action of the peeling. And when we put some acid compound on the skin, it's induced inflammatory reaction, and of course the inflammatory reaction stimulate the turnover and remove the stratocorneum. This is the classical action of every peeling on the market. The mechanism of action, for example, of the classical peeling with TCA is a cascade of events, because the first action is the inflammatory process. Then we have the activation of the skin stress response system, the proliferation and the release of growth factor. Of course, this reaction is not made by the peeling, it's made by our body. So we have an endogenous response of the attack of the acid compound on the skin. So we can define an indirect biostimulation because our body modulates the response. Now we will see the mechanism of action of BIOREPEELCl3. This is divided in 4 action phases. The first one, of course, is like every peeling on the market, is indirect biostimulation. Is made from TCA. The first action is the denaturation of the stratocorneum and the proteolysis of epidermal proteins. In this action, the mix of alpha and beta polyhydroxyacid improve the power of this denaturation and proteolysis. The second phase is made for a part of acid compound, because in the mix of acid there is citric, tartaric, and salicylic acid, and as we had saw before, citric and tartaric acid work like calcium ion chelating, so they remove the binding ions for the caterins, and the salicylic acid have action on the gap junction. So we have 2 different types of opening the way. We create a sort of hole in the skin to vehiculate the biostimulation raw material. Now we will see the phase 3. The phase is the penetration and delivery of amino acids and vitamins, and now we are talking about direct biostimulation. Because, as we have seen before, the first phase is denaturation of the stratocorneum proteolysis. The second phase is keratolytic action and gap junction opening. So we have the way to deliver something in the skin, and we deliver a stimulation raw material like a collagen booster compound with glycine, proline, hydroxyproline, and the cofactor vitamin C. The arginine, that is very helpful for the microbloodstream, the vitamin B2 like antioxidant, and the GABA like Botox-like agent. The last phase is the fourth phase, is the filming and regenerator action, and this is a part of also of the innovative of the product, because when you shake the BIOREPEEL, you can see a green liquid, but it is only a microscopic vision of your eyes, because if you can see in the microscope vision, there is also divide in a yellow and blue phase, but the optical result is the green. As you can see in the bottom, the yellow phase stays down and the blue phase stays up. And for this reason, when you apply on the skin for the difference of the density, the first action is made for the yellow phase, as we can see, we have saw in the 3 phase before, and the 4th phase is made for the blue phase, and it contains squalane and isopropyl myristate, make a direct biostimulation. And the result is very good, because after the classical peeling, you have dry skin, and with BIOREPEEL you don't have, because with the squalane we regenerating the hydrophilic and lipophilic layer attack from the acid. And to summarize, we have the synergy of indirect and direct biostimulation, and the synergy of action bring very interesting action on the collagen production. We have, of course, also histological evidence. We have a very interesting fine line distension, as Agnes have explained with the presentation in the presentation with Professor Cavallini. We have the improving of growth factor and improving of dermal thickness. Why you need to choose BIOREPEEL? Because as we see, it's not a classical peeling, but it is a complete biostimulation aesthetic medical treatment. It's safe, is performing without seeing post-treatment and downtimes. It's multifunction because it's medical device for every part of the body. Is suitable for every type of skin and in every season. Of course, in the summer season, we must to be attention to use the SPF of the treatment, that it can guarantee immediately and long-lasting result. Now we see what our user think. It's very nice for us that we have developed the product. See the doctor that after trying the product, the same things that we have now say to you. Of course, this is Russian, but we have translated and we have seen that they are very happy of the treatments. Some result from UK, I think so Agnes knows who is it. And the last one is the most important slide for us because we made all this work with passion. We made work to give to the people something to be happy, and I want to conclude that all we do is finalize to contribute to the wellness of the beauty of the people. And with this, I finish. If someone has some question, I can take the words to St. Carlo to reply of a lot of questions that I saw.
I have noted a couple of questions which I could answer now. The first one was the contraindications. You always need to check contraindications depending on the regulations of your country. But the main contraindications will be pregnancy and breastfeeding, as always. We do not perform any chemical peels on breastfeeding women for the reason that some of the components they can get through to the the vascular system and be delivered the milk to the baby, so we don't do that. The second thing is no one was performing tests on the breastfeeding or pregnant women, so we don't have enough data so we can surely say that it's safe or not. So for that reason, no, I wouldn't recommend performing treatments on breastfeeding women or pregnant women. So that's the first question. How often can we use the product? It's the session, it's 4-5 sessions every 7 days. If it's in combination with microneedling, it's 7 to 14 days. Remember that the more damaged the older skin is, the inflammatory process, it's going to last slightly longer. So you need to allow for one inflammation process to start calming down before you induce another inflammation. If you do it too quickly, if the inflammation is still present, remember that while the inflammation is present in the body, there cannot be a process of redermalization, regeneration induced. So that's why we need to give slightly a bit more time. So the older the patient is, the longer the period between the sessions will be. So for the maximum, I'm giving 15 days if the skin is really damaged. If there's older patient, 15 days between the treatments. How often you can do it? I have just one problem, in the clinic. The patients want it all the time. So once I finished the session of 4 or 5 treatments, then I'm allowing them to come once in fortnight just for the top up, and it won't harm them, it will just do them good. So you can do it once a fortnight, and after the period of 3 months you can repeat the whole protocol of one treatment every 7 days absolutely safely. Yes, you can use it all year round. Another question which I had, post-treatment will always be BioRelief or BioRehydra, which we're going to talk about in a minute. So I'm just checking all the questions you have. The protocol with microneedling, let me check if I have it here so you can see it on the screen. Just give me a second. I don't think I have it here. Yeah, with microneedling, there it is. I'll try to make it slightly larger, hopefully you can see. If it comes to microneedling, you're cleansing the face, you're degreasing the face. It says about anesthesia. If it comes to anesthesia, I never use anesthesia with microneedling for the reason that anesthesia first of all, it has impact on nerves ending, It has impact on how our body reacts to the treatment. But the most important for me is that it's shrinks capillaries and vessels, it closes them, so all the histamine macrophages cannot be released immediately. Remember, we want to induce inflammation, in the skin, but it's controlled inflammation, and controlled is a main word. And if you prolong the inflammatory process, the healing is going to start later. And what I've noticed with microneedling, I don't have as good effects with microneedling if I'm using anesthesia. For that reason, I'm never using anesthesia with microneedling. You only work deeper on the scars. And of course, on the scar itself, you can use a little bit of anesthesia, but I would not use it on the whole area, on the whole face, if I'm working on the face. I'm going to talk about the scars a little bit more in a minute, because there were some questions about the scars as well. And coming back to the protocol, you cleanse the skin, you degrease the skin. Again, you apply 1 milliliter out of 2 milliliters you prepared in your syringe, you massage it in, you microneedle, you put another 1 milliliter onto the skin, you wait 5 minutes, and then you just remove it with water. So that's very simple. After that, BioRelift or BioRehydra. If it comes to mesotherapy, because there was a question, about the protocol with mesotherapy. Yes, with mesotherapy, I'm going to apply anesthesia because I'm not inducing as much damage into the skin as I do with microneedling. With microneedling, you're inducing so much more physical damage into the skin. With mesotherapy, yes, I'm going to use anesthesia. So I'm going to cleanse the skin. I'm going to put anesthesia 10 to 15 minutes, depending on the strength of the cream you're using. Also check the legal requirements in your country. There's a couple of people from UK. In UK, we can use up to 5.6% of lidocaine, but I know in Emirates Arabs, you can use up to 15%. So please check regulations in your country regarding the lidocaine. After you removed the lidocaine, and you need to remove it really, really carefully, because if anything is going to give you reaction, it's going to be anesthetic cream. It's going to be lidocaine. You're not going to get reaction from the mesotherapy product. Usually they're very safe. And you're definitely not going to get reaction from BIOREPEELCl3. So remove lidocaine very, very carefully, 2 or 3 times. Make sure the skin is really clean. Then I'm performing mesotherapy. And after I did the mesotherapy, which takes me roughly, 5-10 minutes for the whole face, I'm applying BioRepeal on top of that without removing any, blood spots. I just leave everything, just apply BioRepeal, 2 milliliters, massage it onto the skin, leave it for 5 minutes, remove it with water. That's the whole procedure. At the end of the procedure, I'm going to apply BioRelift or BioRehydra. And that's the procedure with microneedling. Another question was about stretch marks and post-acne scarring. Post-acne scarring, it depends what type of scarring, because there are different types of scarring, of course. And depending on type of the scar, you're either going to use microneedling or micropuncture. These are quite large or deep scars. You're going to cut the bottom of the scar from underneath to allow for the rebuilding of the vessels, of the capillaries. I think I need to ask Carla to turn down the volume a little bit. Yeah, thank you. So it depending on the type of scarring, you need to you need to choose one of the 2 methods. It's going to be either microneedling or micropuncture, which is working with the dry needle, or with a tattoo pen. We have some training on that as well. When you're working with the post-pregnancy scars, post-pregnancy stretch marks, I do not really recommend microneedling. These are very deep scars. They are quite wide scars. Then I would use micropuncture, cutting the scar every half a centimeter from underneath, and then just doing a little bit of dry needling on top, just to allow for the mineralization of the skin, mineralization of the tissue. And the protocol is going to be pretty much the same. So you're going to cleanse the skin, you're going to disinfect the skin, then you're going to do microneedling or micropuncture. And on top of that, you are going to apply BioRepeelCl3, and I'm applying body. If it comes to the scars, I'm using the body, or I'm using 42%, which means 1 milliliter of the face and 1 milliliter of the body. You're going to have slightly more peeling. It's going to be slightly more unpleasant. It's going to be stinging, but it works really, really well. And the protocol, I'm going to be doing it every 10 days, not every 7 days, but every 10 to 14 days, depending on the area. If these are large stretch marks on the body, on the stomach, or on other parts of the body, if it's a large area, I'm going to do the protocol every 14 days for 5 sessions. And I think I answered all the questions. If I didn't, I do apologize. So you can just type up the question one more time. But I'm checking. I think I did.
Did you explain in details a little bit the difference from BioRehydra and BioRelift?
I know I didn't. I'm going to do it right now. Just let me take the presentation quickly. It's going to be easier for the participants to see it. Just give me a second, please.
It's already open. This is the BioRelift.
Is it?
Yeah. BioRelift presentation.
Yeah, I got it. Yeah, BioRehydra was created as the procedure product first. It is used it can be used in the salon. I'm using it with microneedling. I think I always have it with me. Yes, of course I have it here. I'm using it with microneedling for all those skins which need hydration, for the skins post-acne procedures. I'm using BioRehydra. You can use it, as I said, just as a procedure with microneedling. So I would do the microneedling, and instead of using any other serum, I'm going to use BioRehydra. It's sterile container, so you don't have to be afraid of any contamination. You just need 1 pump or even less for the whole procedure, and you have wonderful results with the microneedling. If it comes to BioRehydra, it's a post-treatment serum. It has many active ingredients, over 15 active ingredients. One of the most important for me, I'm going to skip for a couple of slides. Just let me skip through it. Sorry. These are one of the most important ingredients and discoveries. I don't think there is another company which would have micronized hyaluronic acid in the molecule between 10 and 5 kilodaltons. Maybe medical companies, but I haven't seen any other company in the field which we're working at which would be able to use the micronized hyaluronic acid in such molecule in their product. As you know, the high molecule hyaluronic acid is just going to sit up the skin, is going to cause just occlusion. So we're not going to get great benefits for our skin. We have high hyaluronic acid, which is going to cause this occlusion, the feeling of the moisture on the belly of the skin. Then we have the high hyaluronic acid and medium weight hyaluronic acid. And the most important for me, the micronized hyaluronic acid. As you know, it's really, really important for the dermis. So all the collagen, elastin could develop, it could be healthy. It also prevents the process of glycation. Which is cross-linking of the collagen fibers, which causing them to be brittle and break easily. But once we have a lot of the moisture in the skin, the collagen and elastin quality is much better. Apart from the hyaluronic acid, the different molecular weight, we included the extract from the algae. Algae have been known for quite a long time now, and they have really great role in repairing dry, tired, mature, straight skin with lots of thickness, skin with photoaging. Anti-aging, anti-wrinkle. First of all, Angli and the components of the Angli will be working on the stimulation of the skin metabolism. We're going to be working basically directly on mitochondria. Are going to be inducing the work of fibroblasts to produce collagen and elastin. And by this, there's going to be reconstructuring of the epidermis and the dermis. They also provide protection from UVB light. What's really important, remember that we include hyaluronic acid, we deliver hyaluronic acid into the skin, but in the same time, we're using the ingredients which are going to inhibit elastinase, which are enzymes that destroy elastin, and also inhibitors of hyaluronidase. So we're helping the hyaluronic acid, which we delivered into the skin, to stay in the skin for longer. The hyaluronic acid, which our body makes, will last just for 3-4 days, but inhibiting hyaluronidase will help our skin to retain the moisture longer. There's always great focus about the hyaluronic acid as the moisturizing agent, but remember that it's also very powerful antioxidant. It's a very important carrier of another substances in the skin. So that's really important to use the cream, use the product, which we recommend post-procedure, so you can maintain the results, so you can allow the good environment for the active ingredients to thrive in and develop collagen and elastin in the skin. Microcystis perifera, one of my favorite ones, because they reduce the signs of aging, which we all need. The blend of the giant food extract with hydrolyzed yeast extract, great composition of amino acids and minerals, and stimulation of HS2 enzyme responsible for the production of hyaluronic acid. So remember, you have inhibitors of hyaluronidase, but also you've got the stimulation of the production of hyaluronic acid, and increases the synthesis of type 3 collagen for the elasticity of the skin. I had a question about, can I use it in keloid scarring? Of course, you can use it on keloid scarring. Keloid scarring are characterized by the fact that they have very irregular capillaries network, and they are not, they don't have good circulation, but also they have lots of unmature collagen, so they're going to be collagen 1 and 3. So by using BioRelieved BioRehydra on scarring as well, we're going to stimulate the repair of the DNA. We're going to stimulate the angiogenesis. The same with BioRestyl-CL3. Definitely can use it on keloid scarring. Sorry, I jumped in, but I just remembered one of the questions from the audience. Of course, you've got the repair of the DNA, GADD45 upregulation. You've got mitochondrial protection and mitochondrial synthesis. Green caviar, very important if it comes to the regulation of the skin, synthesis, regulation of the integrity, and improvement of the integrity of the skin. Functionality and improvement in the integrity of the layers between epidermis and dermis, and very important, activation of the synthesis of collagen 4 and laminin collagen 5, so the collagen which we really want in the skin. So there's very strong anti-wrinkle action. Carlo was talking about amino acids before, so I'm not going to be repeating myself, but amino acids, really I can't imagine good product on the market which wouldn't have amino acids. As you know, these are the building cells, building blocks of every single cell. And the problems which we have in the skin, all the problems come from the molecular level, of the cell level. So there's miscommunication on the cellular level. But delivering amino acids onto the skin, we induce the proliferation of the fibroblasts, we induce the proliferation of the collagen and elastin, but also we can influence the repair of the cell, we can influence the work of mitochondria. So there's lots of amino acids, including leucine, valine, isoleucine. So all those amino acids, when you read about them, when you check, they really strengthen the collagen and elastin synthesis, moisturizing and hydrating action. Arginine, absolutely love arginine. I think this is my favorite amino acid, and I get a huge role in creation of the new capillaries, in strengthening of the new capillaries. So you can use it with all those problematic skin, rosacea, open capillaries, stretch marks, working with scars, absolutely fantastic. Arginine with TCA, which is also buffered with arginine, you can have just guaranteed results. Listen, amino acids, which have very strongly moisturizing properties for the skin, and vitamin C, which is not going to be oxidizing. Carlo was already talking about that, as it's combined and stabilized with glucose. Vitamin B, and then you have this great effect on the acne skins. With the treatment of the acne, I always recommend also oral vitamin B complex, because the lack of vitamin B especially riboflavin, is going to be causing the acne outbreaks. It's going to be causing the oiliness of the skin. So definitely great product for those oily skins. You can use it on the whole body. You can use it on the whole body. You can use it all year round. How I do it, I combine. I just love those products. So I'm using BioRehydra as a serum, and 2 minutes after I'm applying BioRelift. BioRelift, absolutely my favorite product. It's a new baby of the company, which I'm going to talk about in a minute. You can use 2 products combined, as I said. So you can use the BioRehydra as a serum and then add a cream on top of it. If you need more moisturization, you can use it in the morning and BioRelift in the evening. If it comes to BioRelift or BioRehydra, really, I have it in my bag all the time, and I'm using it quite often. For the ladies who have problems with dry lips or the little wrinkles around the eye area, apply it around the eye area. Wonderful results. You can see immediate effect, and it's for the reason because BioRelief is the biometric peptide which going to work on the nerve synapses level and going to have this delicate Botox effect. So they simulate the snake venom effect. So they're going to have really good effect on those superficial wrinkles, on soothing on the skin, very moisturizing. It also contains different amino acids, vitamins. I'm jumping too much. As I said, you can combine it as you want. You can use it during the day, you can use morning, you can use in the evening. For those greasy skins, I recommend definitely BioRehydra because it's going to regulate the sebum production. Use just a little bit. Half of the pump is absolutely enough, or a pump. If you use too much, you're going to have like a little occlusion, little dryness on the skin. And I have the question sometimes, is it normal that I have this little sort of like a dryness on the skin? And the one reason why it's happening, you do it too much. So use just 1 pump enough for the whole face and neck. You don't need to use it more. I think we're going to have 2 milliliters bottles for the salon soon. So 200 milliliters bottles is going to be the salon use. And those ones are going to be the customers, and they sell beautifully. The customers absolutely love buying it. They're coming back quite often for the product. I don't think we have recommended price as such, but in London I'm selling it between £65 and £90 depending on the clinic. So you have really good profit on the home care as well. And the most important for me, it guarantees that you're not going to have any complications after that. For every phototype, I just wanted to check one more thing. Sorry. Carlo, can you just start about BioRelift, please, before I start my presentation?
You want me to open the presentation?
BioRelift.
Yes, that's fine.
Yeah, got it. Brilliant. BioRelift, as I said, it's a new baby in the family. It was presented in Paris. It has more than 20 active substances, such as biometric peptides, which I was talking about, but it enhanced that colloidal platinum. I had a question yesterday about can colloidal platinum be used around the eye area, because colloidal silver is not really recommended. Yes, it's absolutely safe. You can use it around eye area, you can use it around the lip area. It's going to have wonderful regenerative action on the skin. Again, hyaluronic acid, mechanized hyaluronic acid, amino acids, vitamins, and nourishing lipolytic phase of the natural origin. So you've got natural oils. And regarding the natural oils, I don't know. Definitely in UK we have huge problem with all the different fungal infection on the skin, and as you know, natural oil, especially with the fungal infection, is going to help cure it because it's starving the fungi. Fungi is changing the DNA of the skins of the cell, so it cannot recognize it as the aggressor. So I most definitely recommend it to all my clients who have such problems as well. So it's really versatile product. Very good for biostimulating, revitalizing, but the lifting action is also very, very visible. I'm not going to be going through the whole product itself, but as I said, The main difference, it's more moisturizing. It's most for those dry, aging skins. All the other ingredients, such as micronized hyaluronic acid, amino acids, or vitamins, are going to be exactly the same as in BioRehydra. Those biometric peptides enhanced by colloidal platinum are the main difference. You're going to have this Botox effect on the skin, lifting, moisturizing. Absolutely love the product. I really recommend you to use the products with the treatment, because only this way you're going to have the full spectrum. Only this way you're going to be able to achieve quick and really good results. And as I say, it's really important also for the safety of the patients and your peace of mind, because there's nothing which could be colliding with BioRepeel. So that's it from me. If you have any questions, please just write the questions. We try to answer all the questions.
Do you have any other specific question? Otherwise, I think more or less we say everything we have to say.
So we just give you another minute, and if you don't have any questions, you can always drop us an email if you have any questions, if you want any procedures. But as I said, as doctor said, you always adapt the procedures to the patient. You know your patients, you know how to work with the skin. You don't have to attend strictly to the procedure. You can always change it. This is just the guidance. If there's no more questions, I would like to thank you very much for your attendance. I hope you have learned new things about the product and its uses. And if you have any questions at all, please do not hesitate to email us or just get in contact with us. We always answer the questions.
I would like to say just one thing, because we are getting near to the summer, and I would like to tell that I really had the chance to stress the BioRepeel out and to try it in certain conditions. I used also to try it in complete summer, and I used it with people going under the sun, and I've used it almost in any situation. And I would like to say that okay, you have to pay attention, but you can safely use BioRepeel also in, let's say, full spring. Go without problems with the months of May and the first weeks of June. Sorry. Obviously, tell people not to go straight under the sun after the treatment. And also, if you have some frosting, as the colleague said before, it's not a problem. Consider that the frosted part is going to get a little bit brownish, more brown than the other parts, but everything is going to work out perfectly. And if someone of your patients is going to ask you, for example, I think my skin got brown in some places, will it go away? Remember that the formulation of BioRepeel is not capable of doing permanent damages. So at least you're going to have to wait some weeks in the worst case. In the worst case, you're just going to have to wait a little bit more, but everything is going to solve perfectly, because BioRepeel simply cannot give permanent damages. This is quite important, because some people need to be reassured about something that can happen during treatments, because obviously it can happen to find a patient with a really sensitive skin, really sensitive. In these cases, it's important to know that the risk of this kind of this treatment is almost zero with every kind of protocol.
Perfect. One more thing about melasma, because there was a question also about the melasma. Sometimes you have quite deep melasma. So when you're going to start performing the treatment, after the week, the customer or the patient is going to come back to you and say, that the melasma got worse. It's actually, it did not get worse. It's great because we're pulling it from the deep dermis and into the superficial dermis, and then we can get rid of it easily. So the darkening of the skin before, so getting it worse before it gets better, it's absolutely fine, and we should basically celebrate that we made it so quickly. So it's nothing wrong. You know, make sure that you tell the patient not to panic, that it's all fine, and it's just getting the deep melasma from the deep layers of the skin into the superficial ones, so we can get rid of it easily. That's it.
I think so.
Thank you to everyone, to attendance of the webinar. Thank you to Agnes. Thank you to Carlo. And we hope that we give to you some good information and technical information and protocol information to have the use of BIOREPEELCl3.
Thank you very much.
Thank you.
Bye-bye.
If someone needs the recording, please send us the email on our email, on our Facebook page, or in Instagram page. We will be ready to send the registration of the webinar. Thank you and bye-bye.
Thank you.